On today's episode, we have two guests, Jem and Rebecca. Jem leads our engineering team for our Ambient product line. Before joining Commure, he gained experiences at Uber and Microsoft where he worked on cutting-edge technologies and large-scale systems. He founded a climate tech startup during college, raising money from investors and growing a team of 15 plus before ultimately choosing to bring his expertise to Commure full-time, where he continues to push the boundaries of healthcare engineering. Rebecca is a lead software engineer at Commure, leading autonomous coding, note quality, and many other core projects in the Ambient AI team. She worked at Microsoft Research on LLM-related research for 1.5 years, and then founded and ran a B2B software company for 3 years. Her passion is making good products for people with the power of LLMs. Commure is her first step into healthcare, and she is passionate about bringing more efficiency to providers and helping them deliver better patient care. Jem, Rebecca, I appreciate the time and thank you for being on the podcast. So excited to have you both. Wanted to sort of chat through Ambient and Scribe and the healthcare space. Jem, I know we've talked about this a lot, but how do you sort of see the impact that we have today with just software and healthcare?
Something I've seen in the last 3 years here is healthcare is one of those industries that has been deprived of software probably more than any other industry.
Yeah.
We've seen industries like financial services have the advent of technology come in and really make it more accessible, more affordable for the everyday person. Healthcare hasn't been one of those industries, and that's what we're trying to change. I think over my time here in the past, what I've seen is how impactful technology can be in healthcare, specifically for the platforms that we're building as part of our Ambient suite. Being able to give time back to doctors and provide better patient care has been something I've seen change the impact of healthcare through our products almost every single day. What's been awesome to see is we've had some of our own people at the company go to doctors where they're using our products. Between engineers, people in operations. I've heard stories about how they're using our products, it's saving them time. They've had a better patient experience and the doctors love it. So I think being able to experience that on a day-to-day basis makes the work we do more and more enjoyable because I can actually see the impact, which is awesome to see.
Yeah. How do you think about long-term sort of implication in regards to all the suite of different products that we're building today and the areas that we're trying to solve in these large-scale like healthcare systems?
Mm-hmm. I think in healthcare specifically, people don't want to work with 7, 8 different companies. Interoperability is a huge issue in healthcare, the way different systems talk to each other. There's been laws, there's been ways that government has tried to change that, but what we've seen is just not where it needs to be. With our suite of products, what we're really able to do is create an ecosystem where the patient comes first, and we're really empowering the doctors, nurses, anyone in the healthcare system to do more. So I think that's really what we're able to do, and kind of the way the products talk to each other, whether it's from our Ambient platform over to our coding to revenue cycle. It's really a complete solution, and that's what really makes, I think, our platform stand out.
Yeah. Rebecca, what are your thoughts? Because I know that you were a founder for a B2B company, and now this is your first step into the healthcare space. What's your sort of overall take on the impact of the things that you're working on today? And how we're sort of changing the healthcare landscape?
So I think it's a very good opportunity to combine the technical challenge and also the meaningful impact. So I can just, for example, I was working at Microsoft Research, but I'm trying to build very good model just with very high accuracy. Mm-hmm. But I never try to bring use it to solve the real world scenario problem like the health sector issue. So at this company, for example, like Commure, I can build product to saving, even helping the provider save time, and also even improve the patient care here. It's a very, very big impact here, in my opinion. And also, I was working on the B2B startup myself. I used to have a startup. I just trying to improve solving practical issues and helping improve the user experience here. Yeah. But if we can just do it if into the healthcare field, we can just try to fixing more impactful issues. We can improve providers' efficiency, and also we can even give them more time for the patient care. Mm-hmm. That will be very, very impactful and really helping the people's lives.
Yeah.
So it will be very impactful for me.
Yeah, I think we all agree with that, right? I think the reason why we're here is it's a mission-driven company and it has real impact. And I'm excited to sort of talk about Scribe, right? We AI is all the craze today, and there's a lot of talk about generative AI, LLMs. And so for the crowd, Jem, can you talk about what exactly is Scribe? What are the challenges today, and how do you think about solving some of these challenges for these large healthcare systems?
Definitely. Scribe started off as a way to, at first, create clinical documentation. So my past experiences going to the doctors, one of the main pain points I had or that I experienced was when I'm in a doctor's office, the doctor is at their computer, they're typing, they're looking at their keyboard, they're looking at their screen. They might turn over to me when they're doing a physical exam, but other than that, there's not really much engagement.
Same experiences.
Yeah. Our platform, at first, what it tried to do is let's re-engage that interaction. Let's make that a more enjoyable interaction, both for the patient, but also show the patient that the provider cares more about them by being able to actually look them in the eyes and spend quality time, which is what we were able to do. The next benefit that we saw from that is providers actually got more time back. They were able to spend less time documenting, and whether that means go home to their families sooner or see more patients so you don't have to wait a month for an appointment, maybe you can wait a couple of weeks for an appointment. That's what the core workflow was. Let's create that initial documentation and let's save them time when they're editing.
Yeah.
But it became more than that. It became also, okay, how can you save time ahead of the visit? How can you save time and create patient documentation after the visit? How can you reduce the barriers to great healthcare by providing translation services?
Yeah.
So it's more than just documentation. It became really a platform to augment a provider's ability to provide great care. How can you help them with their clinical decision making? Maybe there's a new medication or there's a new procedure and they just want to be able to talk to an LLM that's a medical expert and get context from there.
Yeah.
Obviously, our goal is to never replace the doctor, or our goal is never to replace the doctor, but to rather give them the tools to be able to make better decisions, faster decisions, increase collaboration with nurses and care teams, and just make the whole process of seeing a patient smoother and more effective.
Yeah. Awesome. Rebecca, I know that you're working on some of these core projects on sort of AI, Scribe, Ambient, and some of them revolve around autonomous coding, note quality, and other core projects to the overall product. Can you talk about some of the things that you're working on today?
Yeah, sure. For example, for the autonomous coding, we are trying to generate accurate billing code diagnosis code for the provider. So then provider don't need to spend too much time on the coding themselves. Actually, the coding, for example, coding rules usually update twice a year. And also there are 60,000 codes in total for the diagnosis code and also billing codes. It's so hard for them to make decision for the coding. But if we can just do very accurate code prediction, we can just save them 1-2 minutes per encounter. And also for the node, it's also save much more time. So imagine something if you finish the encounter, you just don't need to do any documentation. The AI will just generate document for you. And then you can just directly use this document. It's already going to the formatting that's what's your preference with, and there will be save at least 5 minutes for one encounter, and then every day will be saved 1-2 hours. You can put this time into either yourself or you can just give it to the patient care. That will be very amazing here.
Yeah, awesome. Jem, we talk about automation from the provider perspective as well as the patient perspective, and I imagine when we think about Scribe and sort of AI documentation as a product itself, there's many things that we could build under it. And I think you alluded to some of those things.
Yeah.
How do you think about, which products to prioritize and which to sort of ship out later based on, healthcare needs and what we feel will drive the most sort of ROI and impact today, or even adoption?
Yeah, great question, Jason. I think the way we think about prioritization here generally is we want to be as close to the customer as possible. I think for us, going on site, getting feedback, whether that's engineers on the Ambient platform or we have an adjacent forward deployed team that's also responsible for going on site, I think what it really comes down to is getting as close to the customer. I think what we've seen is there's overarching themes in healthcare, but at different hospitals, at different health systems, you don't really get to experience the core pain points until you're in person and you see all the clicks, or you see the noisiness of the environment, or you see the one time I was in a hospital and we were working with a doctor in the emergency department, and then a patient with a gunshot wound was being wheelchaired in, and I was just kind of standing on the side. I'm like, okay, I'll give them some time for this one. I'll come back in a little bit. And you don't really get to experience the busyness and that kind of environment until you're in person. So you learn really what actually matters. So for example, in busy emergency department environments, making sure background audio is being removed, and we're able to kind of bring out the key voices in the forefront and make sure we're focusing on those. In some cases, when a provider is seeing 40 to 50 patients a day and they're documenting quickly between, you see how important latency is. You see how important getting a note done in less than 30 seconds becomes. But in other cases, some providers may see their patients all at once and then document at the end of the day. So for them, it's okay if part of these workflows take longer. Quality is the most important, and generating the perfect note from almost nothing, or even if it takes longer, is the kind of the key factor there. So I think what we've learned is in each setting, whether it's acute, whether it's ambulatory, whether it's an ED, or even across different specialties, there's different needs. And what we've built is a platform that's customizable to each provider's needs, whether that's, like Rebecca was saying, different templates or note quality. Note quality is very subjective. Some people might love bullets or paragraphs. Some people might love first or third person. So being able to at least give that customizability to them. Some doctors have done their note the same way for the last 20 years, and they're not going to change that. So it's how can our system adjust to their needs is what we've tried to build over these last few years.
Yeah. Do you see adoption for AI technology in the healthcare space while you're on the ground talking to these providers? Like, what's the general sentiment?
Yeah. I think there's always a little bit of hesitancy at first. They're like, you're going to write my note for me. I don't know if I trust that. Is it going to be accurate? But I think what we've seen is providers, after the first few notes, they're like, you can do all of this just with me speaking into my phone. You can come up with ICD, CPT codes almost automatically after. You can generate emails to the patient so they understand their treatment. So I don't have to do that. I think what it's really come to is people are just so impressed by the impact technology can have. And I think this new generative AI wave is really leading that in healthcare to a level we haven't seen before, almost ever.
Awesome. Rebecca, it sounds like there's a lot of sort of behind the scenes in regards to engineering some of these different features and products. What gets you excited?
The thing make me exciting is when I really see the thing is changing the provider's life. For example, when I was doing autonomous coding, when we see like the accuracy improve and the provider like become more and more trust our coding and they can just directly select our coding, I will feel very proud of it. And also for the no code team, when I see like provider like very positive feedback, it's like I love our notes and it's the best note I ever see. I never need to write my own notes. That would be very, very proud of it, and it's really make me very exciting.
Yeah. Awesome. I want to transition to sort of individuals that want to get into the healthcare space. I think given the market today, specifically in tech, there's not a lot of people that know about what we've been doing in the healthcare space. And Jem, you have experiences at Uber, you have experiences at Microsoft. Like, for folks that want to get into healthcare, what's your sort of piece of advice?
I think what it came down to for me was I was always interested in the industry. I was actually in pre-med before I switched over to computer science. So I had a little bit of interest there. Yeah. My parents wanted me to be a doctor. And then I realized freshman year of college, I don't want to be a doctor.
Like all parents.
Like all parents. Yeah. So rapidly made a switch, but that itch to be still involved in healthcare was still there. For me, what it was is in college, I spent a ton of time doing hackathons, and all my hacks were healthcare, medtech related. I built like diagnostic tools to calculate the frequency of a tremor so people can actually better understand if this tremor is related to this disease or that disease. Because before it would be like, okay, there's a lot of tremor, there's a little bit of tremor, but we can actually assign like a frequency to the vibration of their hand and then be able to kind of allocate it that way. At other hackathons, what I did is we built, integrating with Google Home and Alexa, ways to calculate speech deterioration over time, and then use that to be able to give some insights onto when maybe someone should go to the doctors to maybe diagnose them for Alzheimer's or just detect early signs of Alzheimer's. So not production grade, never really went further than the hackathon, but it was a way where I was able to at least show some of that passion. And then when I was applying to Commure, that was a key part of my resume that stood out. I wasn't necessarily waiting for an opportunity coming to me. I was just building, and then that really matched with the time our Athel's home product. So when I came on, I was working in that regard. Fortunately for me too, when I was at Uber, I somehow magically got placed on the Uber for Health team. So it's part of their Uber for Business organization. And it was essentially giving Ubers to people to get to the hospital and partnering with hospitals so people can get to and from the hospital when they need to. So fortunately, those things worked out. I didn't ask to be on that team. I think maybe they saw that on my resume and wanted to put me on that team. But I think just finding opportunities to be involved, even if you haven't worked in a hospital or your previous engineering experiences aren't in healthcare, as long as you're able to show some interest, whether that's because of family members being in the industry and just why you're passionate about it, I think that's always a great start, and we can go from there.
Awesome. What about yourself, Rebecca? I think doing AI work at Microsoft, I think I imagine would be a lot different than some of the work that we're doing at Commure and Athelus. But what's your sort of piece of advice for folks that want to get into the healthcare space?
Yeah, so for the advice, first you need to have very strong technical skill, or for example, you are a PM, you need to have very strong skill too on that perspective. But then I guess if you enter this field, you need to have more understanding to the clinician workflow. Like you cannot only like have brings down technical skill here, but you also need to really understanding the workflow so you can build very good product for them. For example, autonomous coding, you need to talk with the patient, you need to talk with the provider. You need to look into the node for like 1-2 hours a day, then you can understand how the provider making decision and how the actual coding flow work for each specialty. Then you can make very good like decision-making tree for them. You can just figure out the technical approach for it. If you don't like really enter into this field, understand the workflow, you can never build very good product for them. I guess so that's my advice. You should like have more understanding to the workflow. And also there will be a lot of challenges here. You need to like ready for the challenge or enjoy the outcome. It's going to be very impactful.
Awesome. Cool. Well, Jem and Rebecca, I appreciate the time being on the podcast today. Excited for the work that you two are doing on Ambient AI, and excited for future conversations.
Thanks, Jason.
Thank you.